Hi everybody, my name is Sneha Sunil. I am a third year medical student of ASMI. I am here today to talk about hepatitis A. So hepatitis A is a virus that causes liver inflammation. It is a virus that belongs to the Pincoviridae family. It is a single-stranded RNA that is covered in a capsid layer made up of protein. Since this capsid is not made up of lipid, it is also called naked virus. Speaking of the epidemiology, this virus infects about 1.5 million people per year, and the risk factors of us getting infected are mainly by two ways. One is when we travel to a highly endemic area, and second is when we come in close contact with the infected person. Since this virus infects liver, I'll just talk about the normal functioning of liver. So liver mainly contains two types of cells. One is hepatocytes and second one is Kupffer cells. While Kupffer cells helps in phagocytosis, the hepatocytes helps in detoxification of drugs or any kind of materials in our body, and also helps in protein factors production and the production of bile from cholesterol. So the pathophysiology of this virus is this virus enters our body. It attaches to the hepatocytes and gets inside them by endocytosis. Once inside the hepatocytes, they break off their capsid layer and go and attaches to the ribosome, hence initiating the translation of new viral particles. These viral particles then escape into the bile and through the feces, and our body's immune system reacts to this virus by producing CD4 T cells, CD8 T cells and natural killer cells. So the CD4 T cells helps in decreasing the replication of this virus, whereas CD8 T cells and natural killer cells helps in destroying the hepatocytes which are infected by this virus. So while we look through a microscope, we can see ballooning of the liver cells. We can also see councilman bodies that are dead and decaying cells of liver, and also a high amount of monocyte infiltration. So the symptoms of hepatitis is mainly divided into two phases. One is the prodrome phase and second is the icteric phase. So in the prodrome phase, the patient complains to us about nausea, vomiting, fatigue, malaise, myalgias, etc. And in the icteric phase, that is a jaundice phase, which means there will be yellowing of skin, sclera, mucous membrane, etc. The patient also produces dark urine. They will produce pale stools. They will also have pruritus. Pruritus happens because of bile salt accumulation in the skin, and all these jaundice symptoms appears because of hyperbilirubinemia. Since the hepatocytes are not working, the bilirubin is not excreted through the body. So what happens is this bilirubin builds up in our bloodstream, causing hyperbilirubinemia, hence causing these jaundiced symptoms. So the diagnosis of hepatitis A can be done mainly through serology test, that is by checking the antibody production in our body. Mainly in this case, we will be able to see IgG and IgM concentration. So IgG will be present in our body even after the infection is resolved, hence giving us a long-term immunity against this virus if it reoccurs again. We can also check by RT-PCR, LFTs or clotting time, which can support our diagnosis. The treatment of hepatitis A mainly is supportive care, because this infection resolves by itself within weeks to months, and we can also give medications for the prodrome phase symptoms if they are too aggressive on the patient. So the preventive care against hepatitis A is mainly by having a hygienic lifestyle, mainly by drinking only boiled water, checking on food safety, and a proper hand wash routine. And nowadays we also have vaccinations against hepatitis A, so being vaccinated also helps us fight this infection. So thank you.